Welcome to the deep dive. Today, we're tackling something really important if you're dealing with Social Security disability, especially here in Virginia. We're talking about functional capacity evaluations, or FCEs.
That's right, FCEs.
We want to dig into what they are,
Yeah.
why they matter so much for Virginia SSD claims, and how you can actually use them effectively.
Exactly. Look, for anyone navigating the SSD system in Virginia, FCEs are, well, they're more than just another medical test. They give this detailed, objective picture of what you can actually do work-wise despite your health conditions.
Okay, objective picture. I like that framing.
Yeah, think of it like building a bridge. It connects your medical diagnosis, what the doctor says is wrong, with what you can realistically handle in a job setting day after day. Medical records alone often don't paint that full picture.
Right, they show the what, but not necessarily the so what in terms of work. So let's break it down. What is a functional capacity evaluation in practical terms?
Okay, so at its core, an FCE is this structured assessment. It's done by licensed healthcare pros, usually physical therapists, maybe occupational therapists, and their main goal, to figure out your residual functional capacity, your RFC.
RFC, right, that's the term SSA uses.
Exactly.
Right.
And that RFC is critical because it tells Social Security, in very specific terms, what kinds of work tasks you can still manage given your medical limits.
So it's not just about, say, having arthritis. It's about showing how that arthritis stops you from doing certain job tasks.
Precisely. A typical FCE involves a whole battery of tests, really. They'll measure your physical strength, lifting, carrying, pushing, pulling, assess your mobility, how long you can sit, stand, walk, if you can climb, crouch, that kind of thing.
Okay.
They'll look at dexterity, fine motor skills, hand function, sometimes endurance is tested, even cognitive stuff like concentration or memory, if that's relevant.
And pain, too, is that monitored?
Oh, absolutely. They track your pain levels during the different activities. It's a key part.
What strikes me here is you keep saying measure, assess. It sounds like this isn't just about asking someone, hey, how much can you lift?
Exactly. That's the crucial difference. It's not just subjective reporting, like what you feel you can do. FCEs aim to provide objective, measurable data.
And why is that objectivity so critical for the Social Security Administration?
Well, the SSA needs clear, verifiable evidence. It's how they make decisions. Your own description of limitations, your doctor's opinions, they matter, definitely. But objective data from an FCE gives them a standardized way to measure your functional limits. It helps them see concretely what you can and can't do beyond just the diagnosis.
Like instead of just back pain, it can lift a maximum of 10 pounds occasionally.
Precisely that. It translates the medical issue into a functional work limitation. Very specific.
Okay, got it. So that objective piece really boosts credibility. Now let's zoom in on Virginia specifically.
Yeah.
For our listeners here, why is getting an FCE potentially so important for their SSD claim?
It offers some really significant advantages within the Virginia context. First, like we said, it tackles that medical vocational gap head-on. Your doctor's notes say what's wrong medically. The FCE shows how that prevents you from doing specific job tasks relevant in, say, the Richmond or Northern Virginia job market.
It makes the connection explicit.
Right. Take someone with, severe COPD. Medical records confirm the diagnosis. A pulmonary exercise test as part of an FCE objectively shows, okay, this person's endurance is significantly limited, which directly impacts their ability to do physically demanding jobs common in some parts of Virginia.
That makes total sense. It grounds the medical condition in real-world work capacity.
Yeah.
You also mentioned it helps with those hard-to-measure conditions, like chronic pain.
Yes, absolutely. Conditions like fibromyalgia, chronic fatigue syndrome, or certain types of chronic back pain. Sometimes the objective medical findings are limited. An MRI might look okay, but the person is genuinely debilitated. An FCE can provide that missing objective evidence of the functional limitations. If you report severe pain and the FCE shows you can only sit for 20 minutes, or your lifting capacity is really low, or you struggle with tasks needing focus, that adds serious weight to your claim.
It backs up the subjective complaints with observed data.
Exactly. And that can be vital anywhere, but certainly helpful when dealing with the SSA here in Virginia.
Okay, here's something I bet people wonder about. What if the SSA makes you go to one of their doctors for an exam, a consultative exam or CE? Can having your own FCE still be useful?
Oh, definitely. It can be very helpful. Sometimes those SSA consultative exams are, pretty brief. They might not fully capture everything, especially how your abilities fluctuate or hold up over time.
Right, I've heard they can be quick.
Yeah. So a comprehensive FCE that you get independently provides a much deeper dive, potentially a more accurate picture of your sustained abilities. It's your evidence to counterbalance a potentially less thorough CE report. It gives the SSA more detailed, objective information to consider.
And how does an FCE fit in with what your own treating doctor is saying? Does it help their opinion carry more weight?
It absolutely can. Massively. When your regular doctor, the one who knows your history, says, my patient can't lift more than 15 pounds, having an FCE report with objective testing data showing exactly that, it makes the doctor's opinion much more persuasive to the SSA.
It validates their clinical judgment with standardized testing.
Precisely. If your cardiologist in Norfolk says your heart condition limits exertion and a cardiovascular FCE confirms poor exercise tolerance, that's powerful corroboration.
So consistency seems to be a recurring theme here.
Right.
If the FCE results line up with the medical records, the doctor's statements, and what you're reporting, that builds a really strong case.
You nailed it. That consistency across all the evidence is key. It makes your whole claim more credible, more believable. It reduces the chance that the SSA adjudicator will doubt the severity of your limitations.
Okay, so we've established what FCEs are and why they're so important, especially for Virginia claims. Now, you hinted earlier that there isn't just one kind of FCE. What are the main types people might encounter?
Right, they're tailored. A common one is the general physical capacity evaluation. This gives sort of an overall picture: strength, mobility, endurance, good for musculoskeletal issues, maybe neurological conditions affecting the whole body.
Okay, the general overview.
Then you have work-specific FCEs. These are designed to see if you can meet the demands of a particular job. Might be relevant if your goal is to return to your old type of work, maybe with accommodations.
Makes sense if you have a specific job target.
Yeah.
What about non-physical issues, like cognitive problems or mental health?
Good question. For that, you'd look at cognitive and neuropsychological assessments. These test things like memory, concentration, processing speed, problem solving. Crucial for claims involving, say, a traumatic brain injury or maybe cognitive decline from a neurological condition. And similarly, there are psychiatric or psychological functional assessments. These focus specifically on how mental health conditions, depression, anxiety, PTSD, impact your ability to handle work stress, interact with colleagues, stay focused, follow instructions, the mental demands of work.
Okay. And then more targeted physical tests.
Yeah, definitely. For issues like carpal tunnel or severe hand arthritis, you might have a hand function and fine motor assessment. Really zooms in on grip strength, dexterity, manipulating small objects.
Important for lots of jobs.
Very. Then for heart or lung conditions, there's cardiovascular and pulmonary exercise testing. This measures endurance, oxygen levels during exertion, how your body actually responds. It gives hard numbers on exercise capacity. And finally, there are pain-focused functional evaluations. These specifically try to understand how chronic pain, wherever it is, limits your ability to do various tasks over time.
Wow. Okay. That's a really helpful breakdown. So let's say someone listening in Virginia is scheduled for an FCE, or maybe their attorney recommended one. How should they prepare? What can they do beforehand?
Preparation is definitely key for getting accurate results. First thing, gather your medical info. Make a list of your conditions, your medications. Maybe bring recent MRI reports or doctor's notes if you have them.
Be organized.
Exactly. Dress comfortably, loose clothes, supportive shoes you can move easily in. Big one. Stick to your normal routine. Take your meds as usual. Don't suddenly overdo it or underdo it the day before. You want the test to reflect your typical state.
Don't try to be a hero or the opposite.
Right. Get decent rest the night before if you can. And mentally prepare. It can be tiring physically and mentally. Know that going in.
Okay. And what about during the actual evaluation? Any tips for navigating the testing itself?
Honesty and communication are crucial. Be upfront about your symptoms. If something hurts, say so. Describe the pain, where it is, how intense. Don't push through severe pain just to, impress the evaluator. That's not the goal.
Right.
Communicate clearly if you're having trouble with a task and give consistent effort. They have ways to check if you're genuinely trying on different tasks, so just give your best, honest effort throughout.
Validity checks, you mean?
Yeah, they often build in validity checks. Ask questions if you don't understand instructions. And listen to your body if you need a short break because of pain or fatigue. Ask for one. It's about assessing your sustainable capacity, not your absolute maximum for 5 minutes.
Got it. Not an endurance contest. Okay, so the evaluation's done. What's the actual process like? What should a Virginia applicant expect when they go for an FCE, start to finish?
It usually kicks off with an initial interview, maybe 30 minutes, could be up to an hour. The evaluator reviews your medical history, asks about your symptoms now, your job history, what you do day to day, and how you perceive your limitations.
So a detailed conversation first.
Right. Then they'll do some basic physical measurements, height, weight, maybe check your range of motion and key joints. They'll also just observe how you move, your posture, things like that.
And then the hands-on testing part.
Exactly. That's the main part, the standardized testing. This can take, say, 2 to 4 hours, sometimes even split over 2 days if it's really comprehensive. This includes the material handling tests, lifting boxes, carrying weights, pushing, pulling. They'll test your positional tolerances. How long can you comfortably sit, stand, walk?
Okay.
Mobility testing comes next. Things like climbing stairs, balancing, reaching overhead, bending down, kneeling. Dexterity tests for hand function, both fine and gross motor skills.
And the cognitive tests if needed.
Yes, if cognitive issues are part of your claim, they'll include tasks for concentration, memory, maybe processing speed or following complex instructions. And throughout all this, like we mentioned, they're watching for consistency and using those validity checks, comparing what you say you can do with what they observe.
Okay. And all that data, all those observations, they get compiled into a report.
Yes, absolutely. The evaluator writes up a detailed report. It summarizes everything your performance on each test. Specific limitations found, like maximum lift 20 pounds occasionally, can sit for 30 minutes at a time. It'll include cognitive findings if assessed. Critically, it discusses the consistency of your effort and the validity of the results. Often it compares your abilities to the demands of different work levels, sedentary, light, medium work.
And that report is what goes to the SSA.
Well, you get the report and you submit it to the SSA as evidence. It becomes a really important piece of the puzzle for your Virginia SSD claim.
So you get this potentially long, detailed report back. It might have a lot of technical terms. What are the absolute key things a claimant in Virginia should look for and understand in that report?
Good question. Focus on a few key areas. First, the material handling capacity. What are the maximum weights listed for lifting, carrying, push-pull?
The hard numbers.
Exactly. Second, positional tolerances. How long did they find you could sit, stand, and walk in an 8-hour day? Those durations are critical. Third, the overall work level classification. Did they classify you as capable of sedentary work? Light? Medium? That's a major conclusion.
Okay.
Fourth, definitely read the section on consistency and validity. Did the evaluator find your effort consistent and the results reliable? That impacts how much weight the SSA might give the report. And finally, look for any comments on job-specific capabilities, especially if they tested tasks related to your past work.
Okay, that's helpful. So how does the SSA actually use this information? Where does it fit into their decision-making process?
They integrate it into their 5-step evaluation process. It doesn't replace the steps, but it informs them. It's especially crucial at step 4, can you do your past relevant work? And step 5, are there other jobs in the national economy you can do given your age, education, experience, and your RFC?
So the FCE directly helps define that RFC.
Yes, it provides objective evidence to help the SSA determine your RFC. For someone in Virginia, if an FCE clearly shows you can't even manage sedentary work or can't return to any job you've done before, that can be incredibly powerful evidence leading to an approval.
But what if it goes the other way? What if the FCE report comes back and, it doesn't look great. Maybe it suggests you can do more than you feel you can on a typical day. What then?
Yeah, that can happen, and it's definitely concerning. First step, absolutely crucial. Take that report to your treating physician, the doctor who knows you best.
Get their take on it.
Exactly. Have them review it. Ask them if they agree with the findings, if they think it accurately reflects your usual abilities and limitations, considering your condition fluctuates. They can write a letter or statement commenting on the FCE.
Okay, what else?
You might also consider, did the FCE really test the things you struggle with most? Was it comprehensive enough for your specific issues? Also, has your condition gotten worse since the FCE was done? That's important. Maybe the type of FCE wasn't quite right for your impairment. These are things to think about. And honestly, if you get an unfavorable FCE, that's a really good time to talk to a Virginia disability attorney. They can help strategize how to address it.
Right, get professional advice. It seems like FCEs are really useful, but you're hinting they're not a magic bullet. They must have some limitations, right?
Oh, for sure. They absolutely do. One big one is that an FCE is just a snapshot in time. It's one day, usually a few hours. It might not capture how your symptoms vary day to day or even hour to hour, which is common in many chronic conditions.
Good days versus bad days.
Exactly. Also, it's done in a controlled clinical setting. That's not the same as a real workplace with deadlines, coworker interactions, environmental distractions, all that stuff.
True. The real world is messier.
Definitely. And the duration testing for 3 or 4 hours isn't the same as sustaining effort for a full 8-hour workday, 5 days a week. It might not fully show how pain or fatigue build up over a whole day or week.
That's a really important point.
And then there's cost and access. A private FCE can be expensive, maybe $1,000 or more, and insurance doesn't always cover it for disability purposes. Finding a qualified provider, especially in more rural parts of Virginia, might also be tricky.
So, practical barriers, too.
Yes. But even with these limitations, a well-done FCE from a credible source is still often very persuasive evidence. You just have to understand its context.
Okay, so understanding the limitations. How can someone in Virginia really maximize the value of getting an FCE for their SSD claim? What are the smart moves?
Strategy matters here. First, timing. Think about when to get it. Maybe early on with your initial application to make it strong from the start, or maybe later during an appeal to provide fresh, strong evidence. Discuss this with your attorney if you have one.
Makes sense.
Oh.
What else?
Choosing the right provider is huge. You want someone licensed, obviously, but ideally someone with experience doing FCEs specifically for Social Security disability cases, someone who understands what the SSA looks for.
Someone familiar with the SSA's rules and language.
Exactly. And make sure they're independent, not affiliated with the SSA. Then, communication. Give the FCE provider access to your relevant medical records beforehand, and after you get the FCE report, share it with your treating doctors so they can review it and offer their opinion.
Connect the dots between the providers.
Right. Also, make sure the FCE focuses on work-related functions. Talk to the provider about assessing things relevant to your past jobs or the types of jobs the SSA might consider you for in Virginia's economy.
Tailor it to the claim.
Yes, and integrate it into your overall case strategy. If you have an attorney, they'll help you understand how the FCE fits with the SSA's medical listings, the grid rules, and other evidence. Finally, follow up. Get your doctor's opinion on the FCE results and their long-term view of your ability to work.
Great tips. Okay, let's hit some common questions people might have. FAQs. First one, who actually pays for an FCE?
Usually you do, the claimant. Or sometimes your private health insurance might cover part of it, but often not if it's solely for a disability claim. SSA generally won't pay for an independent FCE you choose to get.
So it's an investment.
It can be, yes, but potentially a worthwhile one. Some Virginia disability lawyers might advance the cost as part of handling your case, too. Worth asking about.
Okay, how long does the whole FCE test usually take?
A comprehensive one. Typically around 3 to 4 hours. If it's more focused on just one area, like hand function, it might be shorter, maybe 1 or 2 hours. Sometimes they split over 2 days to avoid fatigue influencing the results too much.
Got it. Now this is a big one. Can you actually fail an FCE?
Not really fail, like a school test. There's no pass-fail grade. It's an assessment of your abilities on that day. But if the results show you can do significantly more than you've claimed in your application, that could definitely hurt your case. So it's not about passing, but about the results aligning with your claimed limitations. Honesty and consistent effort are the key.
Okay. How often might someone need to get an FCE? Is it just once per claim?
Generally, yeah. One comprehensive FCE is usually enough. But say your condition significantly worsens or your case drags on for a very long time through appeals, an updated FCE might be helpful to show your current limitations. SSA might also request their own FCE at some point.
What about the SSA? If you pay for your own FCE from a private therapist in Virginia, will SSA even accept it? Or do they only trust their own doctors?
No, they absolutely have to consider it. If it's from a qualified licensed provider, the SSA has to review it as medical evidence. Now, they might give more weight to their own consultative exams sometimes, but a well-done, objective FCE from your own source can still be very influential as part of the total evidence package.
That's good to know. Okay, are these tests designed to catch people who might be exaggerating?
Yes, that's part of it. Reputable FCE protocols include those validity measures we talked about, things like repeated tests, consistency checks across different activities, sometimes even specific tests designed to detect non-maximal effort.
So they're looking for consistency.
They are. It reinforces why giving an honest, consistent effort is the best approach. Trying to game the test usually backfires.
Right. Last FAQ. What if you feel the FCE didn't capture a typical day? Maybe you felt unusually good that day, or the short duration didn't reflect your real stamina issues.
That's a really important point to address. If you feel the FCE results aren't representative, discuss it immediately with your treating physician. Your doctor can provide context. They can write a statement explaining that your condition fluctuates, that the FCE captured you on a good day, and that your typical limitations are more severe, or that your stamina decreases significantly over a full workday. Their perspective is crucial here.
So bringing it all together then, the main takeaway for our listeners in Virginia seems to be that FCEs, while not perfect, can be a really valuable tool in an SSD claim.
Absolutely. They provide that objective evidence about what you can actually do functionally, which is exactly what the SSA needs to see. They bridge that medical vocational gap we discussed.
Understanding the process, preparing the right way, knowing how the results are used, it all helps build a stronger case.
Definitely. For anyone navigating the SSD system here in Virginia, either for themselves or helping someone else, really thinking about whether an FCE could help provide that concrete evidence is often a smart move.
It gives objective support to what you and your doctors are saying about how your condition limits your ability to work.
Exactly. Those objective insights from a functional capacity evaluation, they can be a powerful step towards demonstrating the true impact of your health on your work capacity, and that can really influence the outcome of your disability claim.